While people might be able to have dentures that look good from a distance, we consider that our grandparents' technology, but not the technology of the 21st century. We have all of the tools at our command. We have advanced implant systems that can be used. We have digital design and scanning. We have milling and 3D printing, and we can make all this happen in a very short time for patients at a very reasonable cost. The majority of our patients come in with teeth that are decayed, that are loose from periodontal disease, that have dental abscesses and arches with multiple teeth missing. That's a perfect candidate for implant-supported bridges. And surprisingly, it's a fairly young group of patients by all standards. Dentures do not allow patients to chew with full function because they're sitting on gum tissue and the biting forces can't be used that can chew some tough meats and other things like that. Implant-supported bridges support the function of normal teeth. We can chew a normal, healthy diet, everything from salads to meat to whatever are your favorite foods. And people, we find, are anxious once they get their implant-supported bridge. They're anxious to dive back into foods that they've been skipping for years. We consult with the patient, first of all, and give them all their options and let them pick what option they think would fit best into their lifestyle and into their budget. If anyone has any questions about their teeth, about a way to get from where you are now that is not a happy place with teeth that aren't working for you, come and visit with us and we will go through all of your options and let you decide what kind of treatment you'd like to have.